Get out of my OR! Dr. Richardson's voice cut across the room like a blade. He didn't even look up. He just pointed one finger aimed at the small woman standing near the instrument tray and said it again slower, meaner, the way a man says something when he wants to make absolutely sure it leaves a mark. I said, get out, you're cluttering my space. The nurses froze. The residents stopped breathing. Claire Hartwell stood perfectly still, her gloved hands at her sides, her expression giving nothing away. And the whole room waited to see what she would do. She did nothing. She simply stepped back, one pace, lowered her eyes, and let the silence swallow her whole. They had no idea. Not one of them had any idea what they were looking at. Before we go any further, if you're new here, hit that subscribe button and turn on notifications so you never miss a story. Drop your city in the comments right now. I want to see how far this story travels. Now let's get into it. Claire Hartwell arrived at Chicago Memorial Hospital on a Tuesday morning in February when the wind off Lake Michigan was cold enough to make your bones ache and the sky was the color of old concrete. She came in through the side entrance, the one the staff used, with a canvas bag over one shoulder and a paper cup of coffee in her other hand. She wore plain blue scrubs and a pair of worn-out sneakers that had seen better days, and she kept her dark hair pulled back so tight it didn't move when she walked. She didn't look like much. That was if you were the kind of person who thought looking like much was something you could measure just by looking. The charge nurse at the trauma bay desk, a heavy-set woman named Donna, who had worked the floor for 19 years and had seen every kind of person walk through those doors, barely glanced up when Claire checked in. New float, Donna asked, flipping through a clipboard. Yes, ma'am, Claire Hartwell. I was assigned to trauma surgery. Donna looked up then, just for a second, took in the slight frame, the quiet eyes, the way Claire held herself not stiff exactly, but careful, like someone who had learned a long time ago to take up as little space as possible. You done trauma before? Donna asked. Some, Claire said. Donna made a sound that wasn't quite a laugh and handed her a badge. Richardson's running the floor today. Just do what he says and try not to get in his way. He doesn't do well with new people. Claire clipped the badge to her scrub top and nodded once. Understood. She had no idea how much of an understatement that was. Dr. James Richardson was the kind of surgeon who had confused his own competence with his own importance so long ago that the line between the two had completely disappeared. He was tall, broad-shouldered, with silver hair. He wore comb back from a face that had probably been handsome once and now just looked like it expected to be obeyed. He had 14 years at Chicago Memorial. He had a wall full of certifications in his office that he never let you forget about. He had a way of standing at the center of every room, like gravity worked differently around him, like the rest of the world was just background scenery in the story of James Richardson. And the moment Claire stepped into the trauma bay that morning, he looked at her the way a man looks at something he's already decided is beneath him. Who are you, he said, not unkindly, just flatly, like the answer was probably going to be disappointing. Claire Hartwell, float nurse assigned to trauma. Richardson looked her up and down. Then he looked at his senior resident, a young man named Dr. Patel, who had the nervous habit of adjusting his glasses when he was uncomfortable. Patel, Richardson said, is this a joke? Patel adjusted his glasses. She's from the agency, sir. Dr. Voss approved the placement. Dr. Voss approved a lot of things I don't agree with. Richardson turned back to Claire. You ever worked trauma surgery before? Real trauma, not some clinic somewhere, not a nursing home, actual surgical trauma. Yes, sir. Where? A pause, brief enough that most people wouldn't have noticed it. Various placements, Claire said. Richardson made a face like he'd tasted something bad. Various placements. Great. That's very specific. He turned to the group of residents and nurses assembled for morning rounds, raising his voice so everyone could hear what came next. Listen up. We've got a new addition to the team. Ms. Hartwell here is going to be joining us from, where was it, various placements. So let's make sure we explain the things slowly and use small words, because I don't have time today to babysit anyone who can't keep up. A few of the residents laughed. The nurses didn't, but a couple of them looked away, which was almost the same thing. Claire didn't move. She didn't color, didn't clench her jaw, didn't do any of the things a person does when they're trying not to react. She just stood there quiet and still, like a stone in a river, and let it go over her. That was the first thing that should have told them something. But nobody was paying close enough attention. The morning moved fast, the way mornings in trauma always do. There were 2 post-op patients who needed monitoring, a consult from the ER about a man with a ruptured appendix, and a rotation of residents presenting cases to Richardson, who picked apart every presentation with the kind of efficiency that was impressive, until you realized there was genuine cruelty underneath it. He had a particular way of making the residents feel stupid, not by yelling, but by asking calm, measured follow-up questions that made it clear he already knew the answer, and he just wanted them to feel the distance between where they were and where he was. Claire worked quietly. She checked vitals. She updated charts. She anticipated needs before they were voiced, handing an instrument before it was asked for, adjusting a monitor before the alarm sounded, moving into position before anyone told her where to stand. A good nurse is invisible in the best possible way. A great one makes everything around her function better without anyone quite being able to explain why. Dr. Patel noticed. He noticed because he was the kind of resident who paid attention to things that other people dismissed, which was why he was good at his job, even if Richardson made him feel otherwise. Patel watched Claire move through the trauma bay for about 40 minutes before he sidled up next to her during a lull and said quietly, "You've done this before. Like really done this." Claire kept her eyes on the chart she was updating. "Just doing my job." "No." Patel shook his head slightly. "I've seen float nurses on their first day. They're reading labels on everything. They're double-checking every supply location. You walked in here and you knew exactly where everything was." Claire looked at him then, just for a moment. Something moved behind her eyes, a flicker of something that might have been amusement or might have been something older and harder, and then it was gone. "I did my homework," she said. "I always do my homework." Patel opened his mouth to say something else, but Richardson's voice came cutting through the bay. "Patel, stop socializing and get me the CT results on room 4. And the moment was over. It was just past 11 when everything changed. The radio call came in from the paramedics with the flat declarative urgency that never gets easier to hear no matter how many times you've heard it. Gunshot wounds multiple. Adult male mid-40s. BP dropping. They were 3 minutes out. Richardson straightened up from the chart he was reviewing. Something in his posture shifted. The condescension didn't disappear, but it moved aside to make room for the surgeon underneath it. Whatever else James Richardson was, he knew how to work a trauma. "Okay," he said. "Let's move. Patel, you're on airway. Chen, get me 2 large bore IVs ready. Somebody get Oneg on standby." He pointed at Claire without looking at her. "You, stay out of the way and hand things to people when they ask you." Claire said nothing. The patient arrived 3 minutes later, and his name, they learned from the medics talking over each other, was Lieutenant Marcus Webb, former Marine, 43 years old. He'd been found in an alley off South Michigan Avenue with 3 gunshot wounds, one to the left shoulder, one to the abdomen, one to the upper right thigh. He was conscious but barely, and when they wheeled him in, he was the color of old wax, his breath coming in shallow pulls that told you his body was working harder than it had left to give. Richardson moved in immediately, directing traffic, calling for readings. The room was controlled chaos, that specific kind of organized disorder that looks frightening from the outside, and is, from the inside, the only way this kind of work gets done. Residents moved. Nurses moved. Equipment was positioned. Readings were called out. Hands were everywhere. Claire moved to the instrument station and began organizing. She was quiet. She watched. And she started to see things. The pattern of the injuries, the angles, the entry points, the way the wounds related to each other, spatially, it told a story if you knew how to read it. The shoulder wound wasn't just a shoulder wound. The trajectory suggested the bullet had traveled at a downward angle, which meant the shooter had been elevated. The abdominal wound was lower left quadrant, and the exit wound from the way Webb was positioned when they found him suggested a specific rotation of the body at the moment of impact. The thigh wound was a through and through, but the tissue damage pattern around it. "BP is dropping faster," one of the nurses called. 70/40. Richardson was already moving. "Get me a second line. We're going to need to open him up. That abdominal bleed isn't going to stop on its own." He leaned in, examining the abdomen. Classic GSW presentation. "We go in, we find the bleeder, we clamp it." Claire looked at the monitors. She looked at Webb's color, at the way his abdomen was slightly distended on the right side, rather than the left, at the specific location of the entry wound, and what it meant about where the bullet had likely come to rest and what it had torn through on the way. She said quietly, "The bleed might not be abdominal." The room didn't stop, but something shifted in the air the way air shifts before weather. Richardson looked up. "What?" "The distension is right-sided. The entry is lower left, which at that angle—" "I can see where the entry is," Richardson said, and his voice had gone flat and cold. "Thank you for your input. The trajectory suggests the bullet may have deflected. If it's nicked the hepatic—" "I said thank you." He turned back to his resident. "Patel, let's get the liver," Claire said. "The hepatic artery. If that's where the damage is and we open the abdomen without being prepared for it, we're going to lose him before we can—" "Enough!" Richardson's voice cracked across the room like a ruler on a desk. He turned to face her fully, and his expression was the kind of expression that is designed to make a person feel very small. "You are a float nurse on your first day in my trauma bay. You have been here for approximately 4 hours. I have been doing this for 14 years. I have a board certification in trauma surgery, a fellowship from Johns Hopkins, and I have operated in conditions that would make most people in this room weep. He paused, letting each word land. You looked at a patient for 30 seconds and you want to tell me where the bleed is. He said it slowly, like he was explaining something to a child. That's not input, that's noise. And right now I need silence, not noise. Are we clear? The room was absolutely still. Claire looked at him. That flicker again behind her eyes, something that was not fear and was not anger and was not anything he knew how to read. Yes, sir, she said, and she stepped back. Patel caught her eye across the room, and what he saw in her face made the back of his neck go cold. Not humiliation, not defeat. Something else entirely. Something that looked for just a second like patience. The very specific kind of patience a person has when they already know how something is going to end. Richardson opened Webb's abdomen 40 seconds later, and the bleed was not where he expected it to be. What the? He stopped, recalibrated. His hands were already moving because his hands knew what to do even when his brain was catching up. Suction. Now, more suction. Where's it coming from? Upper right quadrant, Patel said, leaning in. It looks like it's near the... I can see that, Patel. But he couldn't not, clearly, because the blood was coming fast now, and the field was compromised, and Richardson was good, but he was working from the wrong starting point, and every second he spent catching up was a second Marcus Webb was losing. The monitor screamed, not the steady alarm beeping that meant caution, but the sustained high-pitched wail that meant something worse. Beep, beep, he is crashing. 50 systolic. He's in V-fib. Starting compressions. No compressions. He's still got a pulse, get me? Richardson's voice had lost its command. It was still loud, but it was reactive now, responding instead of directing. Somebody give me the hepatic exposure set. We need to, It's the hepatic artery, Claire said. She hadn't raised her voice. She hadn't moved from her position against the wall. She said it in the same tone you might use to read a number off a chart. Not, I told you so, not satisfaction, just the fact, laid down like a stone on a table. Richardson looked at her. His hands were inside a man's body blood on his gloves to the wrist, and his face showed what it looks like when a very proud person realizes they are in over their head. The injury pattern from combat GSWs with elevated shooter position, Claire continued, and still quiet, still. Presence differently than conventional gunshot trauma. The deflection pattern is, get her out of here, Richardson snapped. Now, I don't need a lecture. You need a Pringle maneuver, Claire said. Right now, compress the hepatoduodenal ligament to stop the flow, then you can see the artery, then you can repair it. You have maybe 90 seconds before he's gone. The room held its breath. Patel said in a voice that was barely audible, she's right. Richardson's jaw tightened. His eyes went from Claire to his patient and back again. And then something happened that no one in that room had ever seen James Richardson do before. He hesitated. It was a fraction of a second. A blink and miss it moment. But it was there, and every person in that room felt it, and it was the most honest thing Richardson had done all day. Walk me through it, he said. His voice was different. Not humble, that would come later if it came at all, but stripped of the performance. Just a surgeon, just a case. What exactly are you seeing? Claire moved. She didn't rush. She walked to the table with the same quiet purposefulness she'd had all morning, and she leaned in and she pointed, not touching, just indicating, and she began to talk. The words that came out of her mouth were not the words of a float nurse on her first day. They were the words of someone who had seen this before, not in textbooks, in the field, in conditions where there were no monitors and no perfectly stocked instrument trays and no well-lit operating rooms, where you worked with what you had and what you knew, and the knowledge that if you got it wrong, the person in front of you would not survive long enough to know you'd tried. The bullet deflected off the posterior rib. You can see the entry angle and traveled superior medially. At that trajectory, it would have passed through the inferior hepatic lobe before lodging. But the arterial damage is higher than the bullet's resting position because of the shock wave propagation. You're not looking for the bullet. You're looking for the vessel it damaged on its way. Richardson listened, and then he moved. The Pringle maneuver, the exposure, the repair, 3 minutes and 40 seconds from the moment Claire started talking to the moment the bleeding stopped. The monitor steadied, BP climbed, 40, then 60, then 80, climbing slowly, but climbing. Nobody said anything for a long moment. Marcus Webb was still alive. And then, because the body sometimes does things that science cannot fully account for, because sometimes a person who has been through enough, who has survived enough, who has learned in the darkest places on earth, How to hold on. Marcus Webb opened his eyes. They were glassy, unfocused. He was in no condition to speak, to move, to do anything except exist. But his eyes were open, and they drifted across the room with the slow, searching movement of someone trying to find something familiar in an unfamiliar place. And they found Claire. He looked at her for a long moment. Something moved across his face. Recognition. Not the casual recognition of someone you have met before, but something deeper and more specific. The recognition of a person who saved your life. The face you see when everything else has gone dark and a pair of hands reaches in and pulls you back. His mouth moved, just barely, just enough. Doc, he rasped. The word was barely sound at all. Cross. The room didn't understand it yet, but they heard it. Doc Cross. He coughed a wet, exhausted sound. His eyes didn't leave her face. Afghan, she saved all of us. And then his eyes closed again, and the monitors kept their rhythm steady and insistent, and the room held something it hadn't held before. Silence. The real kind. The kind that happens when everyone in a space simultaneously realizes that something has just shifted beneath their feet, and the world they thought they were standing in is not the world they're actually in. Richardson looked at Claire. Patel looked at Claire. Every resident, every nurse, every person in that room looked at Claire Hartwell, who was not looking at any of them. She was looking at Marcus Webb, and her face had changed in a way that was impossible to describe, not softer exactly, but more present, like something she had been holding at a careful distance had just gotten close enough to touch. Doc Cross, Richardson said. His voice was strange, carefully neutral in the way a voice gets when the person speaking it doesn't trust themselves yet with tone. He called you Doc Cross. Claire didn't answer immediately. She reached out and adjusted the flow on Webb's IV drip, a small, precise movement, a habit. Then she straightened and she looked at Richardson, and whatever she'd been keeping behind her eyes all day was still there, still contained, still under her control. He's going to need a second look at that hepatic repair in about 4 hours, she said. There's micro-tearing around the site. It won't hold at full pressure without... Who are you? Richardson said. The words came out differently than anything else he had said all day. Quieter, without the authority, without the performance, just the question. The room waited. Claire Hartwell stood in the middle of Chicago Memorial's Trauma Bay 1, in her plain blue scrubs, in her worn-out sneakers, with someone else's blood on her gloves and the steady beep of a monitor behind her, confirming that a man was alive who 20 minutes ago had been running out of time. And she looked at Dr. James Richardson, the man who had pointed at her like she was furniture, who had called her noise, who had spent the morning making sure everyone in earshot understood exactly how little he thought of her. She looked at him with those steady, unreadable eyes. And she said nothing at all. Because she didn't have to. Because Marcus Webb had already said it. And the truth, once it starts moving, does not stop for anyone. The silence in Trauma Bay 1 did not last long, because silence never does in a hospital. But the kind of silence that followed Marcus Webb's words, Doc Cross Afghan, she saved all of us, that kind left a mark. It settled into the room like a change in air pressure, and every person there felt it in their chest without quite being able to name what they were feeling. Richardson was still looking at Claire, or at Claire Hartwell, or at whoever this woman actually was, because he was beginning to understand with the particular discomfort of a very proud man arriving late to an obvious truth that he did not know. He had assumed he knew. He had looked at her that morning and decided in approximately 4 seconds everything she was worth, and he had been wrong, and the wrongness of it was sitting in his stomach like something he couldn't digest. Someone get me her file, he said. His voice was low, not a bark, not a command, just words. Donna, the charge nurse, who had been on the periphery of everything ending, reached for the tablet on the counter and began pulling up Claire's agency placement information. Her fingers moved fast. The room watched. Claire moved to Webb's side and checked his pupils with a small penlight, one quick pass over each eye. Then she checked the positioning of his central line, made a minor adjustment, and stepped back. Pupils equal and reactive, she said to no one in particular. He's going to want to talk when he comes around. Someone should be here. Ms. Hartwell, Richardson's voice. She turned. Or whatever your name is. He said it without the cruelty he'd used that morning. There was something underneath the words now that might have been in another man something close to shame. I'd like an explanation. Your patient needs post-op monitoring, Claire said. I'd suggest the explanation wait. Patel made a sound that was almost a laugh before he caught it and turned it into a cough. Richardson's jaw tightened, but he nodded, because the maddening thing, the thing he could not argue with, was that she was right again. Webb came first. Everything else was secondary. That was the job. He knew the ground better than almost anyone, which made it worse that she was reminding him of it. They moved Webb to a post-surgical bay, and for the next 40 minutes, the work was the work, monitoring documentation, adjusting fluids, watching the numbers climb toward something that looked like survival. Claire worked through all of it with the same economy of motion she'd had since she walked in that morning. Nothing wasted, nothing performed, just function. It was Donna who found it first. She had been scrolling through the agency placement file on the tablet, and she stopped scrolling, and she read something, and then she read it again, and then she set the tablet down on the counter very carefully, the way you set something down when your hands have started to shake a little. "Dr. Richardson," she said. He was across the room. He came over. She turned the tablet toward him. He read it. His face did something complicated. The agency file for Claire Hartwell was 2 pages. Standard placement information, contact details, certifications, availability, windows. But at the bottom of the second page, under the section marked additional credentials, someone had typed a single line that had clearly been added by the agency coordinator and just as clearly had been overlooked by everyone who'd processed the file that morning. The line read, "Previously credentialed as Dr. Sarah Cross, MD, FACS, military service record, available upon request." Richardson read it twice. Then he looked up at Claire, who was across the bay adjusting Webb's monitor. Her back to him, and he said nothing because for the first time in a very long time, James Richardson did not know what to say. Patel had drifted over without being invited. He looked at the tablet. He looked at Claire. He looked at the tablet again. "Sarah Cross," he said quietly. "Wait, Sarah Cross, that name?" He stopped. His glasses went up. There was a piece in the Journal of Trauma about 18 months ago, Combat Surgery Outcomes in Austere Environments, Afghanistan and Syria. The primary author was Patel, Richardson said. "It was her," Patel said. He wasn't being dramatic, he just couldn't stop the words. "The paper was cited in 3 different surgical protocols that we actually use in this hospital. Right now, our current hemorrhagic shock protocol for GSW cases, it's based on her research." Nobody spoke. Donna let out a long, slow breath through her nose. And then from across the bay, Webb's voice hoarse and barely there, but unmistakably present. "Is she still here?" Every head turned. Marcus Webb was awake. Not fully, his eyes were glassy, and he was working against the sedation still in his system. But he was conscious, and he was looking around the room with the determined focus of a man who had something to say and was not going to let unconsciousness stop him. Claire was at his side before anyone else moved. She was just there the way she'd been all morning, present, before she was expected, close before she was called. "Lieutenant," she said, "you're at Chicago Memorial Hospital. You're out of surgery. You're stable." His eyes found her face, and the relief that moved across his features was raw and unguarded, the kind of thing a person can't manufacture. "Knew it was you," he said. "Saw your hands. Recognize your hands. Don't talk yet. You need to—" "No." His hand moved, tried to reach for her arm, fell short. "No, they need to know." His eyes went to Richardson, who was standing at the foot of the bed now, and then to Patel, and then back to Claire. "She saved my whole unit. Helmand Province, 2019. IED took out our medevac before it reached us. She had nothing. She had a field kit and a headlamp, and she operated on 3 of my guys in a blown-out building with artillery going off 200 meters away." He stopped coughing, and Claire reached for the water on the bedside table and helped him drink without being asked. He steadied. "Saved all 3 of them. Every single one. And then she picked up a rifle and covered their extraction because we were down 2 men. He looked at Richardson. "She picked up a rifle in your OR today." Richardson said nothing. "Then she was probably going easy on you." Patel laughed. A real one this time, short in surprise, and he pressed his hand over his mouth immediately after. But the laugh had already happened, and everyone had heard it. Richardson looked at Claire with an expression that had gone through several phases in the last hour, and had now arrived somewhere that was difficult to categorize. It was not quite remorse, and not quite respect, and not quite embarrassment, but it had elements of all 3 pressing against each other in a face that wasn't accustomed to holding them. "Why didn't you say something?" he asked. "This morning. When I spoke to you the way I did. Why didn't you tell me?" Claire looked at him. "Would it have changed the way you treated the patient?" A pause. "No," Richardson said, "because he was honest enough for that at least." "Then it didn't matter," Claire said. "The only thing that matters in there is the patient." Webb made a sound that might have been agreement, or might have been the sedation pulling at him again. "That's what she always said," he murmured. "Every single time. Only thing that matters is getting them home." The monitor beeped its steady rhythm, and the bay was quiet for a moment. And in that quiet, Claire reached down and straightened Webb's blanket with the same matter-of-fact care she'd applied to every task all day. And something about the gesture, so small, so ordinary, broke something open in the room that the surgery hadn't. Donna turned away and found something urgent to examine on the supply cart. She was blinking more than usual. Richardson cleared his throat. Dr. Cross, he said. The title came out rough, like he was working it past something. I owe you an apology. You owe your patient a second look at that hepatic repair in 3 hours, she said. We can do the other thing after. It was another hour before the second shoe dropped, and when it did, it dropped hard. The hospital administrator, a smooth-faced man named Gerald Ames, who wore suits that cost more than some people's monthly rent, appeared in the surgical bay with the particular energy of someone who has just been informed of something that has implications he hasn't finished calculating yet. He had Richardson's chief of surgery, Dr. Lena Voss, with him, and Voss had the look of someone who had put a great many pieces together very rapidly and was not entirely happy with the picture they made. Ms. Hartwell, Ames said. Dr. Cross, Voss corrected quietly but clearly. She had apparently done her reading faster than anyone else. Ames adjusted course without missing a beat, the way administrators do. Dr. Cross, I wonder if we could speak privately. I'm monitoring a post-surgical patient, Claire said. I can cover, Patel said immediately, and Claire glanced at him, and Patel looked back at her with an expression that said very plainly, go. Let them say what they were come on to say. The conversation happened in a small conference room off the main hallway, and Claire sat across from Ames and Voss with her hands flat on the table, and she listened while Ames explained in the smooth, carefully managed language of someone who wants to control the shape of bad news that there were some irregularities in her placement credentials. Irregularities, Claire repeated. Your nursing license is current, Voss said, cutting through Ames's framing entirely. But your medical license, your surgical credentials, they were placed on administrative hold 8 months ago. You're not cleared to practice as a physician in Illinois. The room settled around that fact like water finding its level. I know, Claire said. Voss studied her. Lena Voss had been chief of surgery at Chicago Memorial for 6 years, and before that she'd done 2 decades of cardiothoracic work, and she had a very good instinct for when a person was telling her everything and when they were telling her the part they had decided she could have. She was certain looking at Claire now that this was the latter. You came here as a nurse, Voss said, knowing you couldn't practice as a surgeon. And then in there, she gestured toward the trauma bay. You directed a surgical procedure. I offered guidance to the attending, Claire said carefully. I didn't touch the patient. Ames opened his mouth. Voss held up one hand and he closed it. Walk me through why, she said. The whole thing from the beginning. Claire was quiet for a moment. Outside the conference room, through the small window in the door, Patel walked past with a chart slowed, glanced in and kept moving. The hospital breathed around them its permanent, unceasing rhythm. I had a situation, Claire said finally. After I came back, stateside, there were, she paused, chose the words precisely, medical board proceedings related to my time overseas. There were decisions I made in the field that were reviewed under civilian standards, and civilian standards don't always translate to what it looks like when you're operating in a building that's being shelled with a headlamp and a prayer. Something moved across her face. The hold is not permanent. The appeal is ongoing. But in the meantime, I needed to work. I needed to be in a hospital. I don't know how to be anywhere else. Voss said nothing for a long moment. Then, how long have you been a nurse? I'm not, Claire said. I mean, my nursing license is legitimate. I did the training. But no, I'm not a nurse. I'm a surgeon who is currently licensed to work as a nurse, and I understand the distinction matters legally, and I understand that what happened in there today is going to require some conversations. She looked at Voss steadily. But that man is alive, and the hepatic repair needs a second look in about 2 hours, and I would like to be the one to advise on it if you'll let me. Voss looked at her for a long time. Then she looked at Ames. Give us the room, Gerald. Ames looked like he wanted to argue. He left instead. The door closed and it was just the two of them, and Voss folded her hands on the table and leaned forward slightly and said, Tell me about the medical board proceedings. All of it. From the beginning. And Claire told her. It took 22 minutes. Claire spoke in the same measured, economical way she did everything. No self-pity, no justification, just the facts laid down in sequence. The mission in Helmand, the 3 soldiers, the decisions she'd made without proper equipment, without backup, without the sanitary margins that the civilian review board expected. The 4th soldier who hadn't made it not because of anything Claire had done wrong, but because by the time he reached her, there had been nothing left to save, and the board had found that distinction difficult to accept. The hold on her license, the attorney who was working the appeal, the 8 months of nursing placements in hospitals around the Midwest, staying close to the work because the work was the only thing she knew how to be. Voss listened to all of it without interrupting. When Claire finished, the room was very quiet. The 4th soldier, Voss said, the board is holding you responsible. They're questioning whether my triage decisions were appropriate, whether the time I spent on the first 3 patients cost the 4th one his chance. Yes. Voss sat back. She let out a breath. That's a question every trauma surgeon had faced at some point, as she said. Every single one of us. You make a call, you triage, you prioritize the ones you can save, and sometimes there's someone on the other side of that decision, and sometimes the board sits in a clean conference room and decides you made the wrong call. She paused. How many total patients did you treat in that building? 7, Claire said. 6 survived. Voss looked at her. 6 out of 7, in a blown-out building, with a field kit. Yes, another silence. And then Voss said, I'm going to make a call, tonight. I know 2 people on the Illinois Medical Board, and I know one of them well enough to ask a pointed question. She stood up, which meant the conversation was ending. In the meantime, you are here as a nurse, and you will function as a nurse, and whatever guidance you provided in that trauma bay today was exactly that guidance from a highly experienced medical professional to an attending surgeon. That is my characterization of events, and it is also if you noticed exactly what actually happened. Claire looked at her. For the first time all day, something cracked just slightly in the careful composure she'd worn since she walked in the door. Not tears, just the particular expression a person wears when they have been holding themselves together for a very long time and someone has just unexpectedly offered to help carry the weight. Thank you, Claire said. Don't thank me, Voss said at the door. Go check on your patient. Claire stood up, straightened her scrubs, moved to the door. Dr. Cross, Voss said. She stopped. For what it's worth. Voss looked at her and the professional distance was still there, but something had softened around the edges. What you did in there today, that's not something that can be taught. That's not something that comes from a textbook or a fellowship or 14 years in a well-funded OR. She paused. That comes from doing the work in the dark when it counts. And this hospital has needed someone who knows what that feels like for a long time. She left. Claire stood in the empty conference room alone for exactly 4 seconds. Then she straightened her badge, rolled her shoulders back, and walked out into the hallway. Webb was awake again when she got back to the bay. More awake this time, the sedation was wearing off, and his color was better, and he was giving Patel a hard time about the positioning of his pillow, which Patel was taking with the long-suffering patience of a man who has learned to appreciate complaints as a sign that a patient is feeling better. There she is, Webb said when Claire came in. Lieutenant. She checked his monitor, checked the dressing, moved with purpose. You get in trouble, he asked. Not today. Good. He watched her work. You know, when I saw you come in the room, I didn't say anything because I figured you had your reasons. For the name, he gestured vaguely. The whole thing. I did. You want to tell me what they are? Not particularly. He laughed short and genuine and then winced because laughing hurt, and he deserved it. Yeah, that tracks. He was quiet for a moment. The guys from my unit, from Helmand. You want to know what they're doing now? Claire looked at him. She didn't say yes, but she didn't look away. Danny Reyes is a teacher, high school San Antonio, math. Webb's voice had gone somewhere private and warm. Kid couldn't do long division when I met him. Now he's teaching algebra. Because of you. He let that land. Tommy Briggs is engaged, getting married in June. His fiancée doesn't know how close she doesn't know. He stopped. And Cooper, little Cooper, who cried for his mom the whole time you were working on him. He's got a 2-year-old daughter. The monitor beeped. Claire's hand had stopped moving over the chart. Just for a second. Just long enough. They're all walking around, Webb said quietly, living their lives. Because you were in that building. He looked at her with the eyes of a man who has been to enough dark places to recognize when someone else has been there too. So whatever's happening with your license, whatever mess you're dealing with, whatever reason you're wearing a nurse's badge instead of a doctor's coat, it doesn't change any of that. You understand me? Those boys are alive. Claire stood very still. I know, she said. Her voice was even, careful, held together with the same steady discipline she applied to everything. But her eyes, just for a moment, said something different entirely. And Richardson, who had appeared in the doorway of the bay without anyone noticing, heard every word and stood there and did not announce himself, and felt the full weight of the morning settle onto his shoulders with a clarity he had not experienced in a very long time. Richardson stood in the doorway of Webb's bay for a long moment after Webb finished talking, and then he did something that nobody who worked with him would have predicted. He knocked on the open door, the way a person knocks when they're asking permission to enter a space they're not sure they belong in anymore. Claire looked up. Webb looked over. Patel, who had been pretending to update the chart in the corner, went very still. Can I come in? Richardson asked. Webb glanced at Claire. The look on his face said he was going to let her make that call. It's your hospital, Claire said. Richardson came in and stood at the foot of the bed and put his hands in his coat pockets, which was not a thing Claire had ever seen him do. He was a man who used his hands to establish authority, pointing, gesturing, gripping clipboards like gavels. Putting them away meant something. "Lieutenant Webb," he said, "my name is Dr. James Richardson. I'm the attending who operated on you today." "I know who you are," Webb said. His voice was neutral, not warm. "She mentioned me to you." "No, she didn't mention anything about herself. That's actually, Richardson paused. "That's part of why I'm here." He looked at Claire. "I've been in surgery for 14 years. I've worked with a lot of people. I pride myself on reading a room reading, people knowing what I'm dealing with when I walk in." He stopped. Let that sit there for what it was. "I did not read you correctly today. I made assumptions based on nothing. On how you looked. On the fact that you were new and you were quiet and you didn't push back when I—" He stopped again. "I said things to you this morning that were unprofessional and unkind, and I want to apologize for them." The room was quiet. "I heard what Webb told you," Richardson continued, "about the building in Helmand, about those men." His jaw moved. "I've never operated outside a controlled environment in my life. I've never worked without power, without a full team, without everything exactly where it's supposed to be. And I stood in my OR today and told you that your input was noise, Webb." He looked directly at her. "That was wrong. I was wrong. And I am sorry." It was not a small thing watching James Richardson apologize. Patel, who had worked under the man for 2 years, looked like he was witnessing something he would tell people about for the rest of his career. Claire looked at Richardson for a moment. Then she said, "The hepatic repair is going to need imaging in about 90 minutes. There's a stress point on the superior margin I want to watch." Richardson blinked. "I'm telling you because you're the attending," she said, "and because you're actually a good surgeon. You just got pointed at the wrong target." Something shifted in Richardson's face. Not relief exactly. More like a man stepping out of a coat that had been too heavy for a long time and realizing he'd been the one choosing to keep wearing it. "What do you need from me?" he asked. "Let me advise on the imaging read," she said. "Formally, through Voss. She's already making calls." Richardson nodded once. "Done." He looked at Webb. "You've got good people looking after you, Lieutenant." "Yeah," Webb said, watching Claire. "I know." Richardson left. Patel watched him go and then turned to Claire with an expression that was trying very hard to be professional and not quite getting there. "That," he said, "is the first time I have ever heard that man say the words I was wrong in that order." "Don't make it weird," Claire said. "It's already weird," Patel said. "It's been weird since 11 o'clock this morning. I'm just choosing to appreciate it." Webb laughed again, and this time he was braced for the pain, so he only winced a little. The afternoon moved. Hospitals don't stop for revelations the way other places might. There are always more patients, more charts, more decisions, stacking up in the hallway waiting to be made. Claire worked through the afternoon shift the same way she'd worked through the morning, quiet and precise. But something had changed in the atmosphere of the trauma floor. It was subtle the way significant changes often are. The nurses who had looked away that morning now met her eyes. The residents who had laughed at Richardson's joke now found reasons to ask her questions. Real questions, the kind you ask when you actually want to know the answer. Donna stopped her near the supply room around 2 in the afternoon and said without preamble, "I looked up the paper Patel mentioned, the one in the Journal of Trauma." Claire kept moving, pulling supplies. "Okay. I read the whole thing," Donna said. On my break." She paused. "I've been a nurse for 19 years. I've seen a lot of surgeons. Good ones, bad ones, ones that were great in the OR and useless everywhere else." She paused again. "That paper changed how I think about GSW triage. I've used those principles in this bay without knowing they came from you." She let that land. "So I owe you one too." Claire looked at her. "You don't owe me anything." "I looked away this morning," Donna said. "When he said what he said to you, I looked away instead of saying something. In my own bay." Her voice was steady, but her eyes were not entirely. "I've been doing this job long enough to know better." Claire was quiet for a moment. "You had no reason to trust me this morning." "Neither did he. The difference is what you do with information when you get it." Donna considered that. Then she nodded once, the nod of a woman who will carry a lesson forward without needing to discuss it further, and she went back to work. It was just after 3 when Voss found Claire in the hallway and pulled her aside with the brief, no-ceremony gesture of someone who has news that needs to be delivered before it gets complicated. "I talked to my contact on the board," Voss said. Claire waited. "The appeal was already moving. Your attorney filed the clinical evidence packet 3 weeks ago, the full surgical records from Helmand, the unit commander's testimony, the subsequent survival outcomes." Voss looked at her with an expression that was carefully controlled, but not entirely unreadable. The board member I spoke to told me, and I want to be precise about this, that the hold on your license has a formal review scheduled for next Thursday. She paused. He also told me, and this is off the record, and it is not a guarantee, and you should not take it as one that the clinical evidence is, in his words, compelling. Claire's face didn't change, but her hand at her side closed slowly into a fist and then opened again. Next Thursday, she said. Next Thursday, Voss confirmed. 1 week. A pause long enough to breathe through. In the meantime, Voss said, I am keeping you on the trauma floor for the remainder of your placement, in your current capacity. She looked at Claire steadily. And I am also personally requesting that you be present for all GSW consultations during that time as a clinical resource. Is that acceptable to you? It was the most carefully constructed sentence Claire had heard all day, and it was a piece of professional architecture that Voss had clearly built very deliberately, giving Claire authority without calling it authority, keeping everything technically within the letter of the rules while moving firmly against the spirit of the limitation. It was elegant, and Claire recognized it as such. That's acceptable, Claire said. Voss almost smiled. Good. Go check your patient's imaging. The imaging on Webb's hepatic repair came back 40 minutes later, and Claire was right. The stress point on the superior margin was showing early signs of tension that would have become a problem within 24 hours without intervention. It was small. It was the kind of thing that might have been missed on a routine read, the kind of thing that required knowing exactly what to look for in Wikipedia. Richardson looked at the image on the tablet. He looked at the point Claire was indicating. He looked at her. How did you know? He asked. The suture placement during the repair, she said. The angle of approach you used, it was the right call, given the exposure you had, but it meant the tension distribution on the superior margin wasn't ideal. I could see it when you were closing. Richardson was quiet for a moment. You saw that during surgery? Yes. And you didn't say anything. You'd already shut me down twice, Claire said. I was watching to see if it would hold. It's borderline. It needs reinforcement, but we have a window. How long, Pipam? If we go in tonight, low risk. If we wait until tomorrow morning. She tilted her head slightly. Manageable, but elevated. Richardson handed the tablet to Patel. Schedule a secondary procedure for 6 o'clock tonight, he said. Dr. Voss has authorized Dr. Cross to consult. He looked at Claire. Will you be in the room? Yes, she said. Good. He handed the tablet back and turned toward the nursing station, and then he stopped and turned back and said, one more thing, the technique you described earlier. The Pringle approach with that specific ligament compression sequence, I've used Pringle before, but not that variation. He paused, and the words came with visible effort, like they were being pulled out of him by hand. I'd like to learn it properly, if you're willing to walk me through it. Patel made absolutely no effort to hide his reaction. He pressed both hands flat over his mouth. Claire looked at Richardson, and this time the thing behind her eyes was not the controlled distance she'd worn all morning. It was something simpler and more direct. It was the look of someone who has been waiting without knowing they were waiting for the right person to ask the right question. After the procedure tonight, she said, we can talk through it. It was the second twist of the day, quieter than the first, but in some ways deeper, because the first twist had been about who Claire was. This one was about who Richardson was choosing to become. The procedure that evening went cleanly. Claire stood to Richardson's right, watching, advising, her voice low and steady and precise. Patel was on the other side, his posture different from that morning, more focused, like he was memorizing everything because he was. The repair held. The superior margin was reinforced with a technique that Claire described step by step while Richardson executed it, and the combination worked the way good collaboration always works. Two people's knowledge making something stronger than either would have built alone. Webb came through it without incident. It was past 9 when Claire finally sat down. She was in the small break room off the trauma floor. Both hands wrapped around a cup of coffee that had gone lukewarm, and the room was empty except for her and the particular quiet of a hospital at night. Not silent, never silent, but slower, deeper. The daytime noise compressed into something you could almost breathe around. She had her phone in front of her on the table, and she had not picked it up, and she had been looking at it for several minutes. There was a text from her attorney. It had come in at 4:15 that afternoon while she was reviewing imaging. She had seen it arrive and had set the phone face down and finished the work because the work came first to always, and also because there was a specific kind of fear she had learned to manage by not looking directly at it. She picked up the phone now. The text was 3 sentences long. It said, board review confirmed for Thursday. New evidence submission acknowledged. Call me when you can. That was all. No prediction, no promise. 3 sentences and a phone call starting. Claire set the phone down again. Picked up the coffee, drank it cold. The door opened and Patel came in still in his scrubs, looking like a man who had run a marathon and won and hadn't quite caught up with the winning yet. He went to the coffee maker without acknowledging her, filled a cup, turned around, leaned against the counter. Long day, he said. Yes, she agreed. Good day, he said. She considered that. Yes, she said again. Patel looked at his coffee. Can I ask you something, and you can absolutely tell me it's none of my business? Ask. The nursing thing, the placement. You've been doing this, what, for 8 months? He looked at her. How many hospitals? 6. 6 hospitals. He absorbed that. You went to 6 different hospitals as a float nurse doing work that, today was not. He stopped, reorganized. You were the most qualified person in that trauma bay today, by a significant margin, and you spent the morning handing instruments to someone who told you to stay out of his way. Yes, Claire said. And you did it. What would you have done instead? She asked, not challenging, genuinely curious. Patel opened his mouth and closed it, and then honestly, I don't know. I'd like to think I would have said something, but he looked at his coffee. I don't know. The work was still the work, Claire said. Patients still needed their lines checked and their vitals monitored and someone to notice when something was off. That's true whether you call me nurse or doctor or nothing at all. She paused. I stopped needing the title a long time ago. Patel was quiet for a moment. In Hellman, he said carefully, when you were operating in that building, what was it like? Nobody had asked her that today. Everyone had asked what she did, what technique, what decision, what outcome. Nobody had asked what it was like. She was still for a long moment. Then dark, she said, and loud. And the floor was not clean, and I couldn't feel my hands very well because it was cold, and there was a point where I genuinely did not know if any of it was going to work. She paused. But they were there, and I was there, and there wasn't anyone else, so you start. You do the next thing, and then the next thing, and you don't think about all of it at once because you can't, so you just think about the thing directly in front of you. Patel nodded slowly. The thing directly in front of you. The patient, she said, always the patient. Everything else is just noise. She looked at him. Richardson's words, this morning, I gave them back to him. Patel looked at her. A slow smile moved across his face, genuine and warm. I noticed that, he said. I was not subtle enough about how much I enjoyed that. No, she agreed. You were not. They sat there for a moment, 2 people who had had a very long and strange day, and the break room was quiet around them. And outside the door, the hospital continued its permanent motion. Patient to patient, crisis to crisis, the endless negotiation between damage and repair. Then Donna appeared in the doorway, and then she was holding a tablet, and her expression had done something Claire had not seen it do all day. It had gone uncertain. I need someone to come look at something, Donna said. Her voice was level, professionally level, the kind of level that is doing a lot of work. What is it? Claire asked, already standing. New patient just came up from the ER. Ambulance brought her in 20 minutes ago. Donna looked at the tablet and then at Claire. She's 17. She came in alone. No ID, no emergency contacts. She won't give her name. A pause. She has injuries consistent with. Donna stopped. The ER doc flagged it as an assault, but the injury pattern. She held the tablet out toward Claire. It doesn't look like a regular assault to me. Claire took the tablet. She looked at the information on the screen. The vitals, the injury notes from the ER doc, the photographed documentation that accompanied the report. The break room was very quiet. And then Claire looked up and something had changed in her face, not the controlled stillness she'd worn all day, not the careful professional distance. Something older and harder and more personal than any of that. Where is she? Claire said. Bay 4, Donna said. Ishvang. She's asking for a woman doctor. She won't let anyone else in the room. Claire handed the tablet back and moved to the door, and Patel straightened off the counter, instinctively reading her face, knowing without being told that whatever was in Bay 4 was not the kind of thing that waited. Get Dr. Voss, Claire said. Jad Bunch? Not? Voss, she was already in the hallway. And call the trauma social worker on call, right now. Patel was already reaching for his phone. Claire walked down the hallway toward Bay 4 with the same quiet purposefulness she'd had since 7 that morning, and every person who saw her move stepped out of the way without being asked because there was something in her pace and her expression that communicated without any words at all that she knew exactly where she was going and exactly what she was going to do when she got there. The curtain to Bay 4 was closed. Claire stopped outside it, took one breath, and then she put her hand on the edge of the curtain and said quietly, My name is Claire. I'm a nurse on the trauma floor. I heard you wanted to talk to a woman. I'm here. Is it okay if I come in? There was a long pause from inside the curtain, and then a voice, small, young. exhausted in the way that goes deeper than tired. Yeah, it said. Okay. Claire went in, and the night, which had already been one of the longest and most complicated of her career in this hospital, was far from over. The girl in Bay 4 was sitting up on the exam table with her knees pulled to her chest and her arms wrapped around them, and the first thing Claire noticed was not the bruising along her jaw or the defensive laceration across her left forearm. The first thing she noticed was how still the girl was holding herself. That specific stillness. The kind of person learns when they've figured out that being small and quiet and taking up no space at all is the safest way to exist in a room. Claire knew that stillness. She had worn it herself for 8 months. She pulled a stool to the side of the bed and sat down, bringing herself below eye level, which was something she had learned a long time ago, not from medical school, but from a forward operating base in Kandahar, where a 14-year-old boy had refused to let any of the male medics near him, and Claire had sat on the ground to talk to him, and he had let her help him after that. You make yourself small. You take up less space than the fear does. Then maybe there's room for something else. My name is Claire, she said again. She didn't add anything else. No title, no credential, no reassurance about how everything was going to be okay, because she didn't make promises she couldn't keep. The girl looked at her, dark eyes older than 17 behind whatever 17 was supposed to look like. A small scar at the corner of her mouth old enough to be fully healed, which told Claire something she filed away without showing on her face. Maya, the girl said, not a last name. Just the one word offered like something she wasn't entirely sure she wanted to give away. Maya, Claire said. Okay, Maya, I'm going to tell you exactly what I know and exactly what I don't know, and then I'm going to let you tell me whatever you want to tell me. Is that all right? A small nod. I know you came in by ambulance about 20 minutes ago. I know you haven't given a last name or emergency contact. I know you asked for a woman, and I know... Claire paused. I know the doctor who saw you downstairs flagged your injuries as an assault. That's what's in the report. She let that sit there clean and unvarnished. What I don't know is what actually happened to you, and I'm not going to assume, so if you want to tell me, I'm listening. And if you don't want to tell me right now, that's also okay. I'm not going anywhere. Maya stared at her for a long moment. Then something in her shoulders dropped just slightly, the way a person's body lets go of tension when it's been holding it so long it's forgotten what neutral feels like. How bad is it? Maya asked. Her voice was flat, not because she was calm, but because she'd spent energy she didn't have getting it under control. My arm. The laceration is going to need stitches. It's clean, it's not deep enough to have hit anything major. Claire was careful about the word clean, clinical but not cold. Your jaw has soft tissue swelling. I need to check whether there's any fracture, which means I need to touch your face, and I'm going to ask your permission before I do that. Does that make sense? Maya blinked, like the asking was unexpected. Yeah, she said. Okay. Claire was gentle and efficient. She palpated the jaw, carefully watching Maya's face for pain response. Intact. No crepitus, no significant point tenderness. Soft tissue damage, but no break. No fracture, Claire said. Hurts, though. Yeah, Maya said. Ribs. A pause. He got me on the left side. Her voice didn't change, but her hand went briefly to her left flank before she pulled it back. Claire kept her expression level. Can I check? Another nod. She was thorough and she was quiet, and what she found made her breath slow in the way it slowed when she was assessing something serious and did not want the assessment to show on her face. 2 of the lower left ribs were tender enough to suggest fracture. The breathing pattern was shallow on that side pane, guarding not pneumothorax, but she wanted imaging. Maya, she said, sitting back on the stool, I think you have some broken ribs. I need to get an x-ray to confirm. If I'm right, it means you need to stay here tonight so we can make sure your lung is okay. She looked at her steadily. Is there anything stopping you from staying? The girl's jaw tightened. Not stubbornness. Fear wearing stubbornness's face. He'll know where I am, she said. There it was. Who will know? Claire asked. Quiet, no alarm, no urgency, just the question. Maya looked at the curtain, then at her hands, then at Claire. My stepfather. Claire held very still. Is he the one who did this? A silence that lasted long enough to be its own answer. Then Maya said, barely audible, he said if I told anyone he'd... She stopped, started again. He said nobody would believe me anyway. The rage that moved through Claire in that moment was cold and focused, the specific kind of rage that doesn't shake your hands, it steadies them. She had felt it before in the field when the damage in front of her had been caused not by war in the abstract, but by deliberate human cruelty in the specific. She had learned to use it as fuel, not fire. He was wrong, Claire said. I believe you. Maya's face did something she clearly hadn't been prepared for. It crumpled, just for a second the way a face does when it's been bracing against something so long that kindness hits it like impact. She pressed her lips together and got it back under control, and Claire watched her do it and said nothing because Maya needed to know she was in charge of herself here, that no one was going to take that from her. There's a social worker on her way, Claire said. Her name is Renee, and she's very good, and talking to her is your choice. Everything here is your choice. Nobody does anything to you in this building without your permission. You understand me? Yeah, Maya said. Her voice was steadier than it had been. Yeah, I understand. The X-ray confirmed 2 fractured ribs, inferior, left no pneumothorax. Claire reviewed the images with Voss, who had appeared just as quietly and purposefully as she did everything, and the 2 women stood side by side in the hallway and looked at the scan and communicated several things without saying all of them out loud. Social worker is with her now, Voss said. She gave a last name. Renee is contacting the Domestic Violence Advocacy Unit. The stepfather, Claire said. We know, Voss said. And then Maya's mother is listed as emergency contact. Renee is reaching out. A pause. The mother may or may not be aware of the extent of it. Claire stared at the scan. She has an old scar at the corner of her mouth, fully healed. This isn't new. No, Voss agreed, it isn't. They stood there for a moment with that knowledge, the particular weighted knowledge of women in a profession that sees the evidence of what people do to each other and is required to hold it and keep working. She needs to stay the night, Claire said. She's being admitted, Voss confirmed. I'll make sure she's on the trauma floor. She looked at Claire. She asked for you specifically, to be the one who checks on her. Something moved through Claire's chest. She didn't name it. She just nodded. Voss turned to go and then stopped. The board review, she said without turning back around. I made a second call this evening to someone on the Clinical Standards Committee. Now she did turn. The 4th Soldier Cross, the one the board cited, I found the field report. The actual field report, not the summary the board used. The timeline of his injuries, the mechanism, the state he was in when he reached you. She paused. No one could have saved him. Not in a full operating room with a complete team and unlimited resources. The cellular damage from the IED was, she shook her head once. The board reviewed a summary that didn't include the forensic analysis of the injury mechanism. Your attorney has the full document now, as of 30 minutes ago. Claire turned to look at her. Where did you find it? Claire asked. I have a long memory and a short tolerance for injustice, Voss said, and I've been doing this long enough to know which files to ask for. She held Claire's gaze. You didn't lose him because of a bad decision. You lost him because some things are not survivable, and knowing the difference between what is and what isn't is what makes a great trauma surgeon. She paused once more. The board will have the full picture on Thursday. What they do with it is up to them, but they'll have it. Claire stood in the hallway of Chicago Memorial Hospital at 10:47 at night, and she held herself very still, and she breathed, and the hospital moved around her, a cart going past a nurse calling something down the corridor, the distant beep of monitors, and she let the reality of what Voss had just said settle into her without rushing it. The 4th soldier's name was Corporal Eli James. He had been 26 years old, and he had been funny. The kind of funny that keeps a unit together in the dark, and she had held his hand for the last 4 minutes of his life, and she had known with the cold clarity of a surgeon who understands what irreversible damage looks like, that there was nothing to repair, that the IED had done something that no amount of skill or speed or desperate effort could undo. She had not operated on him because operating would have been a performance for her own benefit, not his. She had stayed with him instead. And the board had called that a failure. For 8 months, she had carried Eli James with her through every hospital, every placement. Every morning, she put on scrubs instead of a white coat and did the work anyway because the work was all she had. She had carried him not with guilt exactly, but with the specific weight of a death you witnessed up close and absorbed into yourself because there was no other place for it to go. Now Voss was telling her that the weight might have been calculated wrong, that the board had not had the whole picture, that what she had known in her bones in that field that Eli was beyond saving was documented in a forensic report that no one had given the board. She closed her eyes. 1 second, 2, 3. Then she opened them and walked back toward Bay 4 to check on Maya. Renee, the social worker, was a compact woman in her 40s with the particular quality of stillness that very effective social workers develop. She didn't fill the silence around her patients. She just occupied it calmly until the patient chose to fill it themselves. She was sitting in the chair Claire had vacated, and when Claire came in, Renee glanced at her and gave a small, specific nod that communicated several things Maya had talked. It was significant. The advocacy unit was moving. Maya was lying down now, which told Claire the pain was managed enough to allow it. Her eyes tracked to Claire as she came in. "How are the ribs?" Claire asked. "The medication is helping," Maya said. Then after a pause, "Renee says I don't have to go back." "That's right," Claire said. "She says there are options." Maya said the word like she was testing its weight. Options. Like it was a concept that had been theoretical for a long time. "I didn't know there were that many options." "There are," Claire said. Maya was quiet for a moment. "My mom called." The words came out careful, each one placed deliberately. "She's coming, she stopped. She did not know how bad it was. She said," her voice flattened on the last two words in the specific way of someone who hasn't decided yet whether to believe them. "You don't have to figure everything out tonight," Claire said. "You don't have to decide what you believe or what you forgive or what comes next. Tonight you just have to breathe and let your ribs start to heal." Maya looked at her. "Is that what you do when it's too much? You just do the next thing?" Claire remembered saying those words to Patel in the break room hours earlier. The thing directly in front of you. She wondered if the world was circular that way on purpose, if lessons had to travel before they came back to you. "Yeah," she said, "that's what I do." Patel found her in the hallway at 11:15, and his face had the look of someone carrying something urgent. He fell into step beside her. "Webb's asking for you," he said. "He's been awake for the last hour and he's not in pain. He wants to talk." I told him it was late and he said, and I am quoting directly, that he has slept in worse places than a hospital bed and he will stay awake as long as he needs to. "He probably has," Claire said. "I believe it." Patel paused. "Also, Richardson is still in the hospital." Claire looked at him. "It's past 11. "I know, he's in his office. He's been there for the last 2 hours. Patel's voice was carefully neutral. He reviewed the hepatic imaging from tonight's procedure. He pulled Webb's full file, and he stopped. "He asked me if I could get him a copy of your journal paper." Claire stopped walking. "My paper." He said he wanted to read it properly, the whole thing. Patel looked at her. He said, and again, direct quote, "I've been using a derivative of this woman's work for 18 months without knowing where it came from. The least I can do is read the source material." The hallway was quiet around them. "He's a complicated person," Claire said finally. "Most of the good ones are," Patel said. She went to Webb first. He was awake as promised, and he had the alert, steady gaze of a man whose body was damaged, but whose mind was fully present and accounted for. "You look tired," he said when Claire came in. "It's been a long day," she said. "Good long or bad long?" She thought about Richardson's apology, Voss's 2 phone calls, Eli James's forensic report, Maya in Bay 4, Patel's face when he talked about the journal paper, Donna's voice saying I looked away instead of something. "Both," she said. Webb nodded like that was exactly the right answer. "I wanted to tell you something," he said, "before things get complicated, before whatever's happening with your license happens and it gets all official and processed." He paused. "In Helmand, after. When they debriefed us, they asked every man in my unit to describe what happened in that building, what they remembered, the medics, the decisions, all of it." He looked at her. "Every single one of them said the same thing, that you never stopped moving, that you worked on Danny and then Tommy and then Cooper without stopping, without resting, without showing any of them that you were afraid, even though—" He paused. "Were you—" "Yes," Claire said immediately. Webb nodded. "I know, I could tell, but you didn't stop." He held her gaze. "You know what soldiers remember more than anything? Not the people who weren't afraid, the ones who were afraid and kept going anyway. Because that's real. That's something you can trust." He paused. "When I saw you in that trauma bay this morning, when I heard that guy talking to you like you were nothing, I wanted to say something. But I watched you and I knew you had it, the same way you had it in that building." He shook his head slightly. "You don't need anyone to fight your battles." "No," Claire said, "but it's nice not to be alone in them." Webb smiled at that, a real full smile, the kind that must have cost him something with the bruising on his face. "No," he agreed. "It is." She left him at midnight. The floor was quieter now, the particular midnight quiet of a hospital in its slower hours. She passed the nurse's station where Donna was charting, and Donna lifted her hand in a small wave without looking up, and Claire returned it, and it was the most ordinary thing in the world, and also not ordinary at all. She was almost at the elevators when her phone buzzed. She looked at it. A text from her attorney, a man named Howard Graff, who had been representing her case for 6 months and who communicated exclusively in short sentences, intended to save anything worth saying for the morning because he believed in sleep. It was midnight in Chicago, and Howard Graff was texting her. She opened it. It was 4 words. "Board contact reached out." followed by a second text that arrived 10 seconds later, as if he'd sent the first one, and then decided she deserved the rest. They want to move the review to Monday. Claire read both texts, read them again. Monday was 4 days away. Her thumb hovered over the screen. She typed, "Why sooner?" 3 minutes passed, then Howard replied, "New evidence changed the calculation." His words, not mine. "Don't get your hopes up. But also, I think you can get your hopes up." Claire stood at the elevator with her phone in her hand and her coat over her arm, and the whole of this impossible day behind her, and she thought about Eli James and about Danny Reyes teaching math in San Antonio, and about Maya breathing carefully around fractured ribs in Bay 4, and about Richardson sitting in his office reading her research, and about Voss making calls at 10 o'clock at night because she had a long memory and a short tolerance for injustice. The elevator arrived. The doors opened. Claire got in, and the doors closed, and she was alone for the first time since 7 that morning, and she let out a breath that she had been holding, it felt like, for 8 months, and her eyes were not dry, and she did not try to make them so because there was no one watching, and she had held herself together all day, and she had earned 30 seconds in an elevator. The doors opened on the parking level. She walked to her car. She sat in it for a moment without starting it. Then she took her phone out again and typed a text to Howard Graff, "I'll be ready." She sent it, started the car, and drove home through the Chicago night, through the cold February streets, past the lights in the buildings in the city that did not know her name or her story, or what had happened in a hospital on Michigan Avenue today, a city that kept moving the way cities do and always will. But something had shifted. Something that had been stuck for a long time had moved, and it was moving still, and it would not stop now. She had 4 days. And if there was one thing that this day had proven, one thing that every person in Chicago Memorial had seen written in every action she'd taken from the moment she walked in it, was that 4 days was more than enough time for Dr. Sarah Cross to do what needed to be done. The weekend passed the way weekends pass when you are waiting for something that matters, slowly in the hours and fast in the day's time, moving at 2 speeds, simultaneously dragging when you looked at the clock and gone when you looked away. Claire worked both Saturday and Sunday. She had requested the shifts herself, and Voss had approved them without asking why, because Voss understood perhaps better than anyone that some people do not know how to wait without working. The trauma floor received her differently now. Not dramatically, there were no announcements, no formal acknowledgement of what had happened on Tuesday. But the difference was in the texture of things. Residents stopped mid-task to ask her questions, real ones, clinical ones, the kind you only ask when you trust the answer. The nurses moved with her instead of around her. Donna had quietly restructured the morning instrument layout in the trauma bay based on a configuration Claire had mentioned offhand on Wednesday, and had not said a word about doing it, which was exactly the kind of person Donna was. Richardson was a different matter entirely. He was in the hospital both days, which was not unusual for him, but what was unusual was that he sought Claire out. Not to supervise, not to assert anything. He came to her with cases, a post-op patient whose drain output was concerning him, a GSW consult from the ER that had a familiar injury pattern, and he asked her opinion, and he listened to the answer, and he incorporated it, and he did not perform any of this for an audience. He just did it, quietly, consistently, like a man who had made a private decision and was keeping it. Saturday afternoon, he came and stood next to her at the nursing station while she was reviewing labs and said without preamble, "I finished your paper." Claire kept her eyes on the labs. "And it changed the way I think about 3 things I do in every GSW case." A pause. "I've been doing 2 of them wrong." She looked at him then. "Not catastrophically wrong," he said, "but suboptimally. There's a difference between the outcomes I've been getting and the outcomes your protocol produces, and I thought I understood the difference and I didn't." He held her gaze. "I'm going to implement the full protocol in my practice starting next week." "That's a significant change to your workflow," Claire said. "Yes," he said, "it is." He said it the way a man says something when he's already made peace with the cost of it. She turned back to the labs. "Walk me through the 3 things you're changing," she said. "I want to make sure the implementation makes sense for your specific case volume." And just like that, they were working. 2 surgeons, one with a white coat and one with a badge that said nurse, standing at a nursing station on a Saturday afternoon and doing the only thing that had ever actually mattered to either of them. Sunday brought Maya's mother. Her name was Diane, and she arrived at 10 in the morning with red eyes and a compressed mouth and the particular expression of a woman who has just spent 48 hours rearranging her entire understanding of her own life. She came to the trauma floor, and she asked for Claire specifically, and Claire came and met her in the hallway outside Maya's room, and for a moment the 2 of them just looked at each other. "She talks about you," Diane said. Her voice was rough with something that had been cried through and then dried out. "Every time I visited, she brings you up." Maya is a remarkable kid, Claire said. She's a kid who spent 2 years being hurt in her own home and didn't think anyone would believe her. Diane's jaw tightened. I believed her. I want you to know that. The moment she told me I believed her, she stopped. I didn't know. I should have known. I should have seen it. Sometimes the people closest to the situation are the last to have the full picture, Claire said. That doesn't make you a bad mother. It makes you a person who was in an impossible position and didn't have all the information. Diane looked at her for a long moment. Renee told me you have a military background. Yes. She said you've seen a lot of people in bad situations. Yes. How do they, Diane's voice broke just at the edge and she pulled it back. How does someone come back from something like this? Maya, I mean. How do I help her come back? Claire was quiet for a moment, choosing the words the way she chose everything. Carefully, honestly. Without the cushioning that doesn't help. You show up, she said, every day. Not once, not when it's convenient. Every day. And you let her be exactly as angry as she is, for exactly as long as she needs to be. And you don't ask her to make it easier on you. She paused. She's strong. You can see it in how she held herself together long enough to get herself to that ambulance. She did that. On her own, she saved herself. She looked at Diane steadily. Your job now is to make sure she knows that it was worth doing. Diane pressed her hand over her mouth for a moment. Then she nodded one firm, complete nod. Okay, she said, okay. Claire walked her to Maya's room and left them there, and she did not look back because that moment was theirs and it needed privacy to become whatever it was going to become. She was walking back to the nursing station when Webb stopped her. He was in a wheelchair. Patel had apparently negotiated him into it that morning, on the grounds that staying flat for a 5th consecutive day was not doing his circulation any favors, and he had positioned himself in the hallway with the particular purposefulness of a man who has been waiting for someone to walk past. I'm being discharged tomorrow, he said. I heard it, Claire said. Your vitals have been solid for 36 hours. The repair is holding perfectly. I know, Patel told me. He looked at her. You're going to the board tomorrow. She had not told him about the review. She looked at him with a question on her face. Patel, Yeshwam, he said simply. Of course, she said. I want to come, Webb said. You're being discharged tomorrow. You're not testifying at a medical board review 2 days post-discharge from major abdominal surgery. I testified in front of a Senate subcommittee 6 days after a shrapnel injury to my lower back, he said pleasantly. In a suit that didn't fit because the hospital gown was the only thing I owned that did. That was irresponsible. It was necessary, he said. There's a difference. Claire looked at him. He looked back at her. Neither of them moved. Webb, she said, I don't need you to fight my battles. I know, he said. You told me. I agreed with you. He leaned forward slightly in the chair. But that's not what this is. I'm not fighting your battle. I'm telling them what I saw. What happened in that building. That's my testimony to give or not give, and no one gets to make that call except me. He held her gaze. I've been carrying Hellman for 4 years. Let me put some of it down where it does some good. The hallway was quiet around them. Somewhere down the corridor, a monitor beeped. A cart rolled. The hospital breathed. The review is at 9, Claire said. If you're late, we're not waiting. Webb's face opened into a full smile. I'm a Marine. I'm never late. Monday arrived the way the most important days do, ordinary in its mechanics and extraordinary in everything else. Claire dressed in civilian clothes for the first time since Tuesday, a dark blazer and slacks, the kind of clothing she had not worn since before the hold, since the version of herself that walked into rooms as Dr. Sarah Cross instead of Claire Hartwell. She stood in front of the mirror in her apartment and looked at herself for a long moment, and then she picked up her keys and went to meet what was coming. The Illinois Medical Board Review Panel convened in a conference room on the 14th floor of a building on North LaSalle Street, and it was exactly as formal and as quietly intimidating as any room designed to judge people's professional lives tended to be. 5 board members, a court reporter, Howard Graff, at the table next to Claire, and across the room, the attorney representing the board's position. Howard had warned her on the phone that morning, let me do the talking on the procedural pieces. When they ask you to speak, be factual, be direct, don't perform. I don't perform, Claire had said. I know, he'd said. That's why I think we're going to be okay. The board member who ran the proceeding was a woman named Dr. Patricia Okafor, who had 20 years of emergency medicine behind her and who looked at Claire when she sat down with the evaluating gaze of someone who has heard a great many versions of a great many stories and has developed a reliable instinct for which ones are true. The first 40 minutes were procedural. Howard presented the new evidence, the full forensic analysis of Corporal Eli James's injuries, the unit commander's testimony, the corrected timeline of events in Hellman. The board attorney objected to the late submission. Okafor overruled the objection with 2 sentences and the brisk efficiency of a woman who had already reviewed the documents the night before and formed a view. Then they asked Claire to speak. She described Hellman the same way she described it to Patel in the break room, directly, without self-pity, without justification. The building, the field kit, the headlamp, the cold, Danny Reyes, Tommy Briggs, Cooper, each case in clinical sequence, and then Eli James, the state he was in when he reached her. The injury mechanism, the blast radius, the cellular destruction that the forensic report now confirmed had been unsurvivable before his unit had even reached the building. She described what she had done, which was to hold his hand and stay with him, and she described why, which was that operating would have been a performance that served no one, and she did not perform. The room was very still when she finished. Okafor said, "Dr. Cross, the board's original position was that your triage decision represented a failure of your duty to attempt intervention regardless of prognosis. In light of the forensic evidence, that position has been significantly challenged. But I want to ask you directly in the field in the moment, without the forensic analysis, what told you that Corporal James was non-survivable?" Claire looked at her. "Experience," she said. 18 months of forward operating surgical experience told me what unsurvivable blast trauma looks like at the cellular level, and that is what I was looking at. The forensic report confirms the analysis, but I didn't need the report in the field. I needed the years." Okafor wrote something, then she looked up. "The board has reviewed the full clinical record from your 6 overseas rotations. 612 patients. Survival rate 91.4% in conditions that our panel acknowledges are not comparable to any civilian trauma environment." She paused. "Before I move to deliberation, is there anything you want to add?" There was a knock at the conference room door. Everyone looked. Howard turned. The board attorney frowned. The court reporters stopped typing. The door opened and Webb came in. He was not in a wheelchair. He was walking carefully, slowly, one hand on the door frame for exactly the first 2 steps, and then not in his Marine dress uniform, which fit him, and he was pale from the effort and completely immovably present. "I apologize for the interruption," he said to Okafor, specifically because he had identified the authority in the room immediately and addressed it directly the way military men do. "My name is Lieutenant Marcus Webb, United States Marine Corps. I was one of Dr. Cross's patients in Helmand Province in 2019, and I am currently a patient at Chicago Memorial Hospital where Dr. Cross treated me last week." He looked at Okafor steadily. "I asked to make a statement. I was told I could submit written testimony. I decided to come in person." Okafor looked at him for a long moment. Then she looked at the board attorney, who said nothing, because what do you say? Then she looked back at Webb. "You are aware that this is an administrative review, not a court proceeding?" "Yes, ma'am." "And you're aware that you have no formal standing to address this panel?" "Yes, ma'am." A pause. "Sit down, Lieutenant," Okafor said. "You have 5 minutes." Webb sat. He did not look at Claire. He looked at the panel, all 5 of them, and he spoke for 4 minutes and 38 seconds, and he did not use notes because he did not need them, because some things you carry in your body, not in your head. He described Helmand. He described what he had watched Claire do. He described Eli James and what it meant that she had stayed with him, what it meant to a man's unit to know that the surgeon did not leave him alone when there was nothing left to do medically, that she made the choice to be present when intervention was no longer the answer. He said, "In the military, we talk about leaving no one behind. Dr. Cross applied that principle to medicine. She left no one behind, including the ones she couldn't save. That is not a failure. That is the highest form of this work." He stopped. The room was quiet. Then Webb said, "I was discharged from Chicago Memorial this morning. I came here directly. I am going to go back to my hotel room and lie down because this suit is a great deal more uncomfortable than it used to be." A beat. "I just wanted the board to know who they're deciding about." He stood. He looked at Claire, and the look said everything that didn't need to be said out loud. Then he turned and walked back out the door, and the quiet he left behind him was the heaviest and most complete quiet Claire had experienced since the one in the trauma bay when Webb had said her name for the first time. Okafor called a recess. The deliberation lasted 19 minutes. When the panel returned, Okafor did not draw it out. She read from a prepared document in the clear declarative tone of someone who has made a clean decision and intends to state it cleanly. The hold on Dr. Sarah Cross's medical license was lifted effective immediately pending completion of the standard reinstatement paperwork. The original finding of the board was overturned in its entirety on the basis of new evidence demonstrating that the clinical decision in question had been consistent with the highest standard of care available under the circumstances. The case was closed. Claire sat very still and listened to every word. Howard put his hand on the table next to hers, not touching, just near. A gesture that said, "I'm here." "We did it." She nodded once. She kept her face level. She held herself together through the formal conclusion, through the handshakes, through Howard's quiet, elated debrief in the hallway, where he used more words in 5 minutes than she had heard from him in 6 months. And then she was alone in the elevator for the second time in a week, and the doors closed, and she pressed her back against the wall of it and let out a breath and let her eyes do what they needed to do. And she allowed herself for exactly the length of one elevator ride to feel the full weight of what the last 8 months had cost and what the last 7 days had given back. The doors opened. She straightened her blazer, walked to her car, and called Voss. Voss picked up on the second ring. Well, she said. Reinstated, Claire said, effective immediately. A pause that lasted precisely long enough for Lena Voss to absorb it and decide not to be unprofessional about her reaction. Good, she said. Come in Thursday. We have things to discuss about the trauma surgery department. Another pause. Specifically, we have things to discuss about who should be leading it. Claire was quiet for a moment. Lena. Thursday, Voss said firmly. Come in Thursday. The call ended. Claire sat with the phone in her hand. She called Webb next. He picked up on the fourth ring, sounding like a man who had been horizontal for approximately 30 seconds before being interrupted. Reinstated? He asked immediately. How did you know it was me? She said. Only person who'd call this fast. Well, reinstated, she said. A pause. And then from Marcus Webb, a sound she had never heard from him before, a short, rough exhale that might have been a laugh, or might have been something that started as something else and became a laugh partway through. Yeah, he said. Yeah, that's right. You shouldn't have been in that building, as she said. You were discharged this morning. You walked in there 6 days post-major abdominal surgery. The suit was very uncomfortable, he agreed. Worth it. Webb. Cross, and a silence that was not uncomfortable at all. The kind of silence that exists between people who have been in the same dark places and come out the other side and don't need to explain any of it to each other. Danny Reyes is getting married in June, Webb said. He called me last night. He wants you to come. Claire closed her eyes for a moment. Tell him congratulations. Tell him yourself you're invited. All of you are, Reyes said, and I quote, if it wasn't for her, I wouldn't be here to get married, so she better be at the wedding. A pause. He said it slightly less politely than that. He's a math teacher now, but he still talks like a Marine. Claire laughed. It came out real and full, the kind of laugh that doesn't ask permission, and it surprised her the way genuine things sometimes do when you've been guarding against them for a long time. Okay, she said. Okay, Webb said. That easy. That easy. Another pause. Get some rest, Cross, he said. You've earned it. She drove back to Chicago Memorial, not because she was scheduled, not because anyone expected her, but because it was where she needed to be. She came in through the side entrance, the staff entrance, the same one she'd used on Tuesday morning, with a canvas bag and a paper cup of cold coffee, and the hospital opened around her the way it always did, permanent and purposeful and indifferent to the smallness of any single person's story. Patel was at the nursing station, and he saw her come in, and he said immediately, Tell me. Reinstated, she said. Patel closed his eyes, pressed both hands flat on the counter, and took one long breath in and out. Then he opened his eyes and said, I told Richardson this morning that whatever happened today, I was buying coffee for the whole floor. He said if it was good news, he'd buy lunch, so. He looked at her. Tell me again so I can go tell him. Reinstated, she said again. Patel grinned in full and genuine, the grin of a young doctor who had watched something important happen and was old enough to know it. Then he turned and walked briskly toward Richardson's office, pulling out his phone. Donna appeared from around the corner of the supply room with the specific timing that told Claire she had been listening since the elevator. She stopped in front of Claire and looked at her for a moment, and then she held out her hand. Claire shook it. It was a handshake between professionals, between equals, between two women who had spent their careers in the same difficult, necessary work and who understood each other now in the way that is only possible after you have worked side by side through something real. Thursday, Donna asked. Thursday, Claire confirmed. Donna nodded and went back to her station. Claire walked to the trauma bay. She stood at the entrance for a moment, taking it in. The monitors, the equipment, the organized space that was built for the worst moments of people's lives, and staffed by people who had decided deliberately that this was the work they wanted to do. It was not glamorous. It was not clean. It was the hardest kind of work there was, and it had been her work since she was a resident, and she had never once in all the places it had taken her wanted to be anywhere else. Richardson appeared behind her. He had clearly come directly from his office. He was still holding the coffee mug he'd apparently had when Patel reached him, and he had the expression of a man who has received news he needed to hear more than he knew. He stood beside her in the entrance to the trauma bay, and neither of them said anything for a moment. I owe you a proper introduction, he said finally, since the one I gave you on Tuesday was not my best work. No, she agreed, it wasn't. Dr. James Richardson, he said. Trauma surgery, 14 years. Currently revising approximately 30% of my clinical practice based on the work of the person standing next to me. He paused. And if you'll have it, whatever the opposite of an enemy is. Claire looked at him, and for the second time that day, she laughed. Real and honest and unguarded. Dr. Sarah Cross, she said. Trauma surgery, 2.5 years conventional, 4 years combat, and 8 months as the best qualified float nurse in the Midwest. She held out her hand. Whatever the opposite of an enemy is, sounds about right. He shook it. The trauma bay hummed around them, monitors, equipment, the ventilation system, the particular breathing of a space that is always ready, always waiting, always prepared to receive whoever comes through its doors in whatever condition the world has left them in. It was ordinary, and it was everything. 1 week had passed since Claire Hartwell walked in through the side entrance of Chicago Memorial Hospital with a canvas bag and a paper cup of coffee and a secret that was about to change the shape of everyone in this building. 1 week since a man with 3 gunshot wounds had opened his eyes and said her real name out loud, and the room had never been the same. 7 days. 1 Marine who refused to stay down. 1 girl who saved herself by making it to an ambulance. 1 chief of surgery who made calls at 10 o'clock at night. 1 resident who paid attention when other people didn't. 1 charge nurse who had looked away once and decided she never would again. And 1 doctor who had spent 8 months